Yes, we can.
Okay, great. I first want to say it's really kind of an honor to come behind Seth and his team because I admire them so much, and we've had some education back and forth for purposes with the PACE program. So it's just great to see them and kind of connect again and hear all the good things they're doing. I love that program. So, okay, I am Hazel Teichen. I am the outreach coordinator for the Bluegrass Care Navigators PACE program. And I'm thrilled to be here today to share some information about this program that's now available in several counties in Kentucky. So PACE stands for Programs of All-Inclusive Care of the Elderly, and the goal of this is really to get people the care they need to be able to thrive at home. So what is PACE? As I said, it stands for Program of All-Inclusive Care of the Elderly. It actually is not a new program, although it's new to Kentucky. It started in the 70s in San Francisco. There were a group of community caregivers that were really struggling to sort of coordinate care for their loved ones to be able to keep them safe at home. So it's got a grassroots beginnings that is really quite remarkable. And then in the 90s, it became under Medicare and Medicaid. So it is a Medicare Medicaid program. The reason I want you to be sure to understand that is that we didn't create this program. It's a proven, oiled machine. It's got great outcomes. So we are just the first to have brought it here to Kentucky last July. So PACE is a comprehensive healthcare model that provides managed care to our participants, and we do call them participants, not patients. Once someone is enrolled in PACE, that care is coordinated by a dedicated healthcare team to help the participant maintain their independence in their own home. Our goal is to keep them out of the nursing home. So our experts connect with participants in all aspects of their care, and we support their needs, including everyday tasks. And everything, if you've met one PACE participant, you've met one, because each of them, as you can imagine, is an individual with different needs, different medical conditions, different places they are in their well-being or their care. So we look at them very individually, and they do have a voice in their care. So I love that about PACE. So PACE is not a nursing home, even though we're trying to keep people out of the nursing home. It is a day center and clinic that's operated Monday through Friday, 8:30 to 4:30. Our clinic is located in Lexington. It is in what was our previous hospice medical clinical office. When we combined our 3 offices and put them in one headquarters down the road, this became sort of the perfect template to build out this concept of PACE. So it is a center that is kind of like an adult daycare, kind of on steroids, very elaborate. And then we have the clinic attached. However, people are tethered to us in their care 24/7, 365. So just because we operate out of the clinic in those hours, we do take care of individuals, basically around the clock with their needs. So our services are provided at the PACE Center and at home as assessed by the team. So some people may come to the center quite frequently and others not so much, but we do that based on assessments. If you qualify for services, you have to be Medicare and Medicaid or Medicaid only. The services are 100% covered and it is free. There's no co-payments or deductibles. So it's a pretty amazing program for a very niche population. If you have Medicaid, that's the place to begin. You have to have Medicaid. If you have Medicaid and Medicare, you have to have Medicare without an Advantage plan. So it starts to kind of, when we peel back that onion of insurance, it gets a little bit tricky to get to the people who actually can enroll, but it is a program that's designed for Medicare and Medicaid individuals. In the state of Kentucky, well, actually the government CMS, they pay Bluegrass Care PACE program X amount of dollars based on a capitated rate per participant per month, and we have to make those dollars cover everything that they need. So we're very driven to provide preventative care. This is national PACE data, and I like to show this just because you can kind of see where the majority of PACE centers are located. They're heavily on the East and West Coast. The blue states do not have PACE centers, so we are really proud that we were able to flip Kentucky from blue to purple. To enroll in PACE, you have to be 55 years or older. You have to live in the PACE service area. So for Bluegrass Care Navigators, that is Anderson, Fayette, Franklin, Jessamine, and Woodford counties. You have to be certified by the state of Kentucky to need nursing home level of care. And I know that sounds a little bit contrary to the nursing home. We're trying to keep you out of the nursing home. But that's not really a very big lift. If you needed help with a couple activities of daily living, that might be all it takes to get you qualified to be able to meet that nursing home level of care. And then you have to be able to live safely in the community with PACE support at the time of enrollment. So we have to, people have to be in some stable housing. We can't enroll individuals who are homeless. This again, with this national data, I like to point out that in 2012, there were about 25,000 PACE participants across the country. And just a little over 10 years later, there are now over 63,000 individuals being served by PACE services. So it's had a pretty impressive growth rate. The average PACE participant is 77 years old. 69% of those are women. And you can see here with the need for activities of daily living, 26% of PACE participants of that 63,000 need help with 1 to 2, which is what qualifies them, but 33% of them need help with 5 to 6. So usually people have several things that are going on that would meet that eligibility for nursing home level of care. So Mrs. Jones is the sort of model PACE participant. She's an 80-year-old woman who lives alone. She qualifies for nursing home care, but she wants to stay home with her cat and near her neighbors where she's lived all her life. She needs assistance with 3 activities of daily living: bathing, dressing, and preparing her meals. Before PACE, Mrs. Jones needed support from her daughter for appointments and prescription management. She visits the PACE Center 4 times a month, and a home care nurse supports her personal care and medical needs at home between visits to the center. So that kind of paints a sort of a standard profile, and certainly there's people that have different needs than that, but this is kind of what a typical PACE participant would look like. This is the interdisciplinary team model, which is quite robust. We do have a primary care provider here. His name is Dr. Jim Borders. He's our medical director and primary care physician. We have a social worker, physical therapist, registered nurse, recreational therapist for all the activities, a dietitian who can really help with those special needs for the meal part of health, occupational therapist, a PACE center manager, a home care manager, a personal care attendant, and a driver. So all these people meet twice a day. We meet once in the morning and once in the evening. In the morning, we kind of discuss what's before us for the day, who's coming in, what are the needs, who has appointments. And then in the end of the day, we kind of debrief what happened today, what needs do we need to address, and what's on the docket for tomorrow. So it's a very lots of eyes and oversight to help that individual make sure we're addressing their needs. So it includes, think of it as sort of intensive primary care. Primary care physicians are not designed to do all that PACE can provide, and that's not to say they're not doing their job. It's just to say that's not their kind of call to provide that care. So PACE can kind of go beyond that. We do know there's individuals who use their primary care physician and have a lot of need. They may need help with meals, securing meals. They may need help with transportation. They may have some behavioral issues. They may not be compliant. And we can provide all of those extras to help ensure that that individual is getting the care and support that they need to stay in their home. So we have nursing care. We talked about the therapies. We do provide activities here in the center, lots of fun activities. It's a great place for socialization because PACE is a social medical model. We provide exercise depending on when they come to the center. Most people come, or the participants, they come somewhere between 9 and they may stay till 2 or 3:30. They'll get breakfast, lunch, and a snack. So the meals are really a bonus and a plus. We know a lot of people face food insecurity, or they're choosing between, food and medication. So they do get healthy meals that are all designed by our dietitian. We have a beautiful, full commercial grade kitchen that we prepare those meals in. And then if they need meals beyond being in the center, we can set up meals for delivery through Mom's Meals for those that might need to receive their meals that way. So all of that is included. We also have social services. Our social worker can help with finding placement if their apartment is no longer adequate or they need to make a move. We can help with that. She can help with advanced directives. She can help with securing a phone, any of those things that we know people really don't know where to go to get. So she can help with all of those needs, certainly a lot of behavioral issues, things like that she can help find resources for. We do have mobile dentistry. They come once a month. We know that dentistry is very important to people. A lot of the people that we serve may have not had good dental care, which is, plays into their health overall. So we do provide that dental care for them. Once a month, we have, done everything from extractions to dentures. Again, that's all based on assessment and what their needs are, but it is all free to them, what we provide. And then audiology, we do, hearing tests, hearing aids, optometry with glasses and eye care, cataract surgery, whatever it might be, and podiatry. So it's kind of a one-stop shop, which is really the design of it, is to make it very easy for the individual to get all the services that they might not know how to access individually. They also can get medical equipment, anything from wheelchairs, walkers, oxygen, hospital bed, diabetic testing supplies, incontinence supplies. We have put a ramp on someone's house. We will provide, grab bars, things in the home. We do that safety assessment periodically at enrollment, and then again every 6 months when we design that plan of care. So we can provide all those things that can really make caregiving easier for their family members if they live with them, or if they live individually, we can get them the equipment they need to stay safe. Outpatient and hospital services. So anything outside of what we can provide here, we arrange and contract with outside providers to get that done. So we do have lab, you can get your lab draws here, but we can also do them in the community, radiology, x-rays, any outpatient surgery. We do have contracts with UK, we have contracts with Lexington Clinic, we have contracts with some nursing homes because there is occasion for some of our participants to do respite in a nursing home, and we have to have contracts with them. We have, the contract with the dental provider, the audiologist, and all those are all contracted people who take care of our patients. We do all the scheduling for those appointments. And the reason that we do that is because we have actually Bluegrass PACE becomes their insurance provider and their medical provider. So we're going to pay the bill for whatever services they receive. So we need to coordinate and schedule those appointments so that we know where they're going and we make sure we get them there. And also that provider knows that the insurance is going to be PACE, that we're going to pay that bill, that the individual is not going to pay that bill. And then we also have the inpatient contracts to provide, for any emergency room visits, hospitalizations, inpatient specialties, and skilled inpatient rehabilitation. So let's just say an individual took a fall in their home, broke their hip, called 911. They took an ambulance to UK. They went into the ER. They went in and had surgery. They had to have rehab, so they went to one of these skilled rehabs, and then they returned home. Bluegrass PACE Care has paid for every step of that care. So they are our financial responsibility for all that medical need that they might have. Because our goal, again, we're very driven to try and prevent the need for those kinds of things to happen. And because all the healthcare services are received at the center and coordinated by us, our participants have to know that they could be fully and personally liable if they went outside of what we knew they were going to do for medical care and we weren't involved in it. They may be liable to pay that bill because we have to coordinate those services. Additional supportive services, our primary care physician, we do have on-call hours, 24 hours a day, 7 days a week, which is a great, I think, stress reliever for families and individuals, just to know that they can actually call someone at 3:30 in the morning on Christmas Eve and they could speak to an actual PACE client, clinical person. We do provide the transportation to and from the PACE Center from all 5 counties and to those outside medical appointments. We know that transportation can be a real barrier to people being able to get to their outside appointments, whatever they might need. And this is scheduled transportation. So this is not, like regional Lexington transportation where you make an appointment and you wait, or you have to be standing outside. This is door-to-door transportation. We do provide the prescriptions and over-the-counter medications, behavioral health, medication management, which we know is a huge concern. Individuals getting medications from a variety of physicians and doctors for all kinds of things, and no one's looking at the big picture. So that's a big part of what we can do. We do help with advanced care planning. And then other services are provided as they're deemed necessary by the team of healthcare professionals to improve and maintain the overall health of those PACE participants. So when someone comes to PACE, we really kind of start with a conversation with them about what are your goals? What is it you hope to have PACE help you with? Certainly they come and we know that we can probably identify a long list of needs that they have, but we're going to kind of engage with them to see what theirs are and kind of let those float to the top and support those sort of more urgent needs first, because we don't want to overwhelm them and just kind of take over. That's really not a good approach, because many of these people have not, had access to healthcare, and they're still kind of leery about it. And part of it sounds too good to be true. And they still want to keep their own, autonomy with it. So that's what we do. And then once we develop that plan of care, we discuss it as a team, and then we also have to present it to the participant and their caregivers or family if they have them. We have to give it to them or explain it to them in a language that they understand, and they actually have to sign off in agreement. So they do have a voice in what care will be delivered for them. We do offer, PACE is a great option for people who are caregiving for someone in their home, or in their, maybe your mom's in her own home, but you're taking, you're overseeing all her care. We can really help with that supportive service, taking care of many of the things that become burdensome, that maybe are overwhelming, between not only having the 24-hour access, but we can bring them to the day center. They can get that socialization. When they come to the center, it's really quite a lovely place. We have a large and small activity room. We do have a computer center where they can get on the computer if they'd like. We do have all those activities. We have what we call quiet rooms, which are mandated by PACE to have those. There are rooms that are set aside where there's comfortable chairs and they could actually go and take a nap, read a book, or just be alone if things become too overwhelming in the activity room. We also have a full therapy gym. So that's another great feature. They can come here, they can get their therapy, they can get their breakfast, and we have showers. We have 3 wonderful roll-in accessible showers. They can come here and get showers, which I had no idea until I started working with PACE, how difficult it is and how many people struggle to have access to a safe shower. They may live in a community where there's communal showers. They can't have a shower chair because someone would steal it. There's just all kinds of things, or their caregivers just are overwhelmed and can't really assist to provide safe showers. So that's a wonderful feature here at the PACE Center. They can get therapy, they can get showers. We can do 1 load of wash a week. We have a beauty shop. So they have lots of extra perks that come along with their care that are all included in their enrollment. We do talk to them some about what matters most to them. I did mention that to you, kind of seeing where they're at. We did have one woman where her goal was to be able to stand up long enough to be able to wash her dishes. So we kind of look at what are the things that they're hoping for, and then we take it from there, and put those things in place to make sure that we can help them achieve those as much as possible. So, keeping it kind of in their world and what matters in their day-to-day. The goal of PACE is certainly to look at, is a person interested in longevity? Are they really trying to improve their quality of life and move forward? Are they really just trying to improve their function? Maybe it is important, like that lady that wanted to be able to wash her dishes. Some of those things could be where their focus is. And then maybe it's just comfort. Maybe they're not as driven for all of that, all the things that come alongside with trying to move their life in a certain direction. They just want to have good medication management, some socialization, and be cared for at this time in their life. And when you come under PACE, we do kind of anticipate that we will have some people with us for up to 15 or more years. There is no reason that they would need to leave the program unless they choose to disenroll. And so we expect that we might have some people all the way to end of life where we would provide palliative and hospice services for them. It's very easy for someone to make a referral to PACE. It does not require a physician's order, which is really great. All you need is to make sure that, first of all, they live in one of the counties that is served by a PACE organization. We really would like to know if they're Medicare and Medicaid. They have to be Medicaid to get into the program. We need their name and a phone number and permission to call. So if you call our intake department or you call or email Sandy Gowdy, she is our participant enrollment specialist, and she will take it from there. She'll reach out to them. She kind of starts that introduction, starts to build that relationship, sees if they meet the eligibility based on the insurance, and we kind of take it from there. So it's very easy. Anyone can make a referral for PACE services. As of today, right now, there are 3 providers in the state. We cover the 5 counties I mentioned. Horizon PACE, which is a large adult day provider in sort of out of Richmond and through central Kentucky, southeastern Kentucky. They cover these Barron, Clinton, Estill, Jackson, Laurel, Madison, McCreary, Pulaski, Rockcastle, Warren, and Wayne. And then Senior Community Care, which is Visiting Angels up in Northern Kentucky. They are just opening their doors in Jefferson County. They have some traction behind them because they have already got PACE centers in Indiana. So that'll be really great. They'll be able to kind of hit the ground running. So let's see what else. This is just, I'm not even gonna play those because I'm not sure they'll play. Does anybody have any questions about PACE? I know that's kind of a lot of information. I will tell you that we've had about 440 referrals and we've had 39 people eligible to enroll in the program. Some of that is, it's a new program. It's a really big message that kind of starts large and narrows down to a very niche population. Part of it is maybe I haven't been promoting it or introducing it to the right audiences yet, but from the get-go, it was just, let's get the word out to everybody. So we've told lots and lots of people. I've done 160 presentations to get the word out. Our biggest barrier is not, because when you come under PACE, you have to give up your primary care provider. So our biggest barrier is not that. Our biggest barrier is we had maybe 10 people that were hesitant. Some people don't want others in their business. There's a little bit of that, but the majority is the insurance. A lot of people have Medicare and do not have Medicaid, or they have Medicare with an Advantage plan and no Medicaid, or they have Medicaid with a waiver. So we can't accept people that have a waiver program because that's kind of runs alongside a lot of similar things we're trying to do. So it's kind of, like I said, it's a little bit of a niche population, but we do know that the individuals are out there. We do know, that it's hard sometimes to reach them because they tend to be a little bit off the radar possibly. But if you're hearing about it today, it may be that somewhere in, along the way, you'll meet someone or know of a neighbor or a family member of a friend that really could benefit from PACE services. So we're kind of trying to make sure everybody just is aware of this kind of unique program that's now available in Kentucky. And as far as when you go on the CMS website, there are about 5 counties in Kentucky that have not been spoken for. All the rest have a letter of intent in Frankfurt to consider opening PACE. So the state should roll out with PACE in the next several years very nicely, we hope. So,
any questions for Hazel?
It says, I am understanding PACE can be utilized by folks who live with family in order to stay in their home. I know many who are having difficulty navigating the medical waiver, home and community-based services. I would say, as far as the waivers go, if someone is eligible for a waiver and they're on the waiting list, they should consider checking out PACE, because it could be that PACE is a better fit, and there's no reason they couldn't possibly be in PACE until that waiver comes into play. They may be waiting 6 months to 9 months to get that waiver, and they could be enrolled in PACE if they meet the eligibility. So I would absolutely encourage anybody that's on a waiting list to at least do the exploratory with Sandy to see if you meet the eligibility. Because if you meet it for a waiver, you're likely going to meet it for PACE. That's a very good question. We did have, sometimes we had one individual who came under the services and we didn't know they had a waiver because there's no way for us to know that unless they tell us. They ended up disenrolling because the family member was being paid for the caregiving. And of course, that was their income. So, but, that's part of our learning curve as to how we navigate this. And we certainly understand that that could be the case, that family members are making their income by, working for that waiver. Any other questions? The value for this for Kentucky is, a lot of the individuals who we serve, they were high utilizers. Certainly, Seth and his team know some of those individuals who are using the ER as their primary care. They're non-compliant with their medications. They're maybe in just overall bad health. So for Kentucky, they used to kind of have an open checkbook for these individuals. Now with PACE, they know exactly how many dollars they're going to spend, and we take on the financial responsibility. So for Kentucky, that's a win. It also, the coordination under PACE, that very intensive interdisciplinary team should really be able to work to eliminate some of those unnecessary medical services that people tend to, maybe use that they don't need. So that should help reduce that utilization of the ER and the hospital and the rehospitalizations. That's certainly the goal of PACE, and certainly why the state of Kentucky said, yes, let's bring this program here. So that's a really good thing for the state of Kentucky.
Any other questions?
Good. I want you to pass on the information. I also want you to know if there's anyone else you can think of that needs to hear this message. I would love for you to let me know, and I would love to reach out to them because I'm trying to connect. And you're in the fall prevention business. Certainly, we know that that's where a huge issue in elderly and their health overall. They can take one fall and their whole world can change. So I want to also mention having dementia is not a barrier we have at all. About 46% of those 63,000 have some sort of dementia. Behavioral health is not a barrier, and neither is HIV/AIDS. If you meet all those criteria, those things are not a barrier, which we know sometimes can be a barrier for those individuals to accessing other services. We did have a grant-funded program through, this is in the chat, through the Bluegrass Care Navigators. It is a dementia program. It's a dementia transition program. It was grant-funded for 3 years, and unfortunately, it's coming to an end at the end of September. So anyone that's in the program right now will be able to continue to be served through that, but they won't be taking any new enrollees after the end of September. But we got several of our PACE participants out through that program because we had so much more we could offer. But that was a great touch point to find those individuals and be able to help. So, anything else?
I did have a question. I'd sat through a webinar on, and I hope I pronounce this right, Uniper. Are you familiar with that?
It sounds familiar, but I'm not sure I know why it sounds familiar.
It was a program where they were letting older adults
Oh, yes,
use
yes.
TV, smartphone, tablet, and it was all web connect. And I liked it because it kind of made a community for people that were homebound.
Correct. That's through the Bluegrass ad.
Okay.
And they got, I think they've got, either they purchased or got a grant. I'm not sure how it worked, but they had 100 slots to bring that program to individuals. So it's definitely worth checking out at the Bluegrass ad. I'm trying to think, Sarah, I don't know her last name. Mary Crawley Schmidt would know about it, but that's very
Sarah,
interesting program.
Sarah Eldridge was the
Yes, Sarah
contact.
Eldridge,
Mhm.
correct. Right. Yeah, that was intriguing. Yeah, because people have all kinds of levels of interest in being comfortable with engaging and may not be able to go out, but they can get some good education and some socialization. That's really awesome. Thanks for mentioning.
And I guess that was my question. And I take from your answer that it's not part of PACE. You can't.
It's not part of PACE. She did offer it to us, but at this time, the majority of our individuals would not. I don't believe they'd benefit from that. They're
Okay.
It's just the technology part alone would be very difficult. Many of our individuals are in very modest homes with very limited access to internet and all kinds of things. So, but it looks like a fascinating program for sure.
With PACE, is there I assume there's an economic level you have to be below?
Correct. It's 2742 is sort of the threshold for Medicaid. And then we can help someone apply for Medicaid if we, if they believe that they would be able to get it, our social worker can help. It is the requirement for, we can also take MCOs in Medicaid, even though we can't take Advantage plans in Medicare. So I think part of that is just because it really is directed at a niche, part of the population that's been somewhat underserved.
Mm-hmm.
And that's who we're really focusing on to help.
Any other questions?
Well, if there aren't many questions, it means I did a really good job. That's the only way I can interpret that.